To the Weiner Wellness Week. Today's Tuesday. My name's Dr. Ross, and I'm going to be kicking off. My presentation today is going to be kind of going over chiropractic treatment and the modalities we use here at the World of Wellness. All right, I guess we'll get rocking here with the PowerPoint. So I'm a chiropractor, also went for a master's in sports rehabilitation, and just recently this year I actually got certified as a chiropractic sports physician, which is pretty darn cool because that was the reason I went for my master's, and learned a lot from that, and so love working with athletes as well. And the cool thing about having that is you could actually even use some of the principles that you use to treat the athletes just on everyday folk. Just because, you know, whether it's picking up a case of water from out of your trunk or doing any kind of gardening or anything, everything's kind of like an athletic movement. So we could kind of tailor and use some of those principles just to treat everyday people. So we're going to dive right into it. So the first thing we're going to do is talk about the history of the laser. So basically, laser therapy in the early 1900s, Albert Einstein discovered a couple properties about it. And later in 1917, he explained the theory of stimulated emission, which is basically the principle of how lasers get used today. And it started becoming a therapy in 2003. The FDA started using it. So how the laser therapy works. Basically, it's a red light, and it uses photon energy. So the photon energy enters the mitochondria of the cell and reacts with what's called a chromophore, which is the photosensitive chemical in the mitochondria. And if we go back to 8th grade biology, the mitochondria is the powerhouse of the cell. So when you get the photon energy into the cell and it hits the chromophore, what you have is an increase of adenosine triphosphate, which is just a fancy word for cellular energy. And a couple things about the laser. We have to do it over direct skin because the photon energy won't penetrate through the clothes. So you have to get it on the skin just so the light's absorbed by the chromophores. And so basically what the laser is doing, it induces a biological response in energy. So you basically produce more ATP so you could heal 100 times quicker than what you normally would. So photobiomodulation, that is the fancy word for laser, just because basically what that means is it's the photon energy's effect on tissue. And the best analogy, how I explain to all my patients, so just how sunlight hits a plant for the plant to grow and heal, we're basically donating photon energy to the cells in your body so you could heal quicker than normal. And you heal and repair quicker because when that photosensitive chromophore receptors absorb that photon energy, a ton of different biochemical changes occur in your body. So these are just a couple of the effects from the laser therapy. You have an increase in that ATP, increases nitric oxide, which results in vasodilation, so you actually can get more blood to the area so the area could heal quicker. It affects the calcium ion channel on the nerves and cells. So why that's important is if you've ever yourself or anybody you know have ever said, "Hey doc, I got a pain in my neck and it's running down my arm. I got some numbness and tingling in my hand, numbness and tingling in my feet." You have 3 channels on a nerve: a potassium, a calcium, and a sodium ion channel. When the photon energy hits the calcium ion channel on the nerve, it's going to kind of help to shut it down. So I call it like a leaky nerve. So if you're having any kind of numbness, tingling, burning, itching, whatever nerve sensation, think of a straw with a bunch of holes in it. It's a leaky straw, so it's a leaky nerve, so it keeps depolarizing, so you keep feeling that sensation of pain. What the photon energy does is it closes down the calcium ion channel on the nerve, so it kind of plugs up the holes in the straw so you have a better signal so you don't feel that ridiculous symptom. So not only does that help with any kind of carpal tunnel syndrome, it helps with any kind of radiculopathy, so low back pain running down an extremity. So it basically helps to just take the inflammation and close up the calcium ion channel on the nerve. What it also does, increases cellular proliferation, release of growth factor, and it actually alters the pain threshold at the local level. So that's a couple different things that the laser does. And this is just an article. This was 2016. It talks about the cytochrome C oxidase that occurred, so you could, have the increase in ATP. And then it also talks about, at the bottom here on this slide, the hemodynamic altercation, so it facilitates neuronal functioning. So, AKA, there are a couple studies that people that lasered over the frontal cortex of your brain, it actually increases your brain function, which doesn't hurt. Does not hurt. So this is just another study that they came out with too. And the cool thing about this one was if we look at the bottom, the low-level light therapy to the forehead benefits cognition in healthy humans, including enhanced intention, working memory, and executive function. So anybody like post-stroke, post-concussion, or any kind of neurological disorder going on, you could actually, and I like to use the topical CBD because CBD is a natural anti-inflammatory and a neuroprotectant. So if you use the laser therapy and the photon energy to kind of drive and facilitate the CBD into the tissue, it just kind of down-regulates everything. So that's what's pretty cool what the laser does for the brain. And I definitely use that with like post-concussion patients, whether it's like hockey goalies, soccer athletes, they benefit pretty great from that, and you actually respond a lot quicker from your concussion. A couple other things that the laser therapy does: faster tissue repair and faster wound healing. So this was one of the first uses of it in 2003, was for any kind of diabetic ulcers on people's heels or in their lower extremity. So what was happening was, if you had, and actually how I got turned on to the laser was in grad school. So we had a quadriplegic patient. He was in a wheelchair, I think it was about 10 years, and he had a diabetic ulcer on his heel. He went to every kind of ologist you could think of, and he was actually going to have his leg amputated. So last-ditch effort, right down from his house, there's a chiropractic clinic where I was working at. And he came in and we lasered his heel 2 times a week for 15 weeks. And it honestly, it closed up the open wound in his heel, and he did not have to get his leg amputated. So when I first saw the laser, I was like, this is just a warm light. This isn't doing anything for you. But when you see that happen when you're in grad school, especially like my last trimester, that solidified it for me. So not only is it going to help, that was the first use for like the open wounds to kind of heal any kind of ulcer, but it does a ton of other things too. So we use it a lot over here. So we were talking about the neurological disorder. So it helps with the brain function, post-stroke, post-concussion, helps with the channels on the nerve, but it's also going to facilitate any kind of healing. So different uses. Tennis elbow, plantar fasciitis, and there's a litany of different things it could be used for. How it works for like plantar fasciitis and tennis elbow. So tennis elbow is called lateral epicondylitis. The biggest thing here is the suffix of the word being itis. So itis means inflammation. And what the laser does locally is it decreases inflammation at that level. So if you're having any kind of Achilles tendonitis, plantar fasciitis, it's going to decrease the inflammation so you could heal quicker. And then one of the other modalities we have here is cupping therapy. We got a question? Yeah. So laser, way safe. There's only 3 contraindications. If you can't laser over a pacemaker, you can't laser over a spinal cord stimulator. If you have an active site of malignancy, so like an active malignant tumor, can't laser over that. And it depends on who, what research articles you read. But me personally, I do not laser any kind of pregnant women, just because that could kind of take blood flow away from the fetus. There are certain, instances where people do laser that, but no, I'm not going to do that. I'm not compromising any kind of health. So those are the 3 main contraindications. Besides that, everything's pretty safe. And you could even laser young kids too. So a lot of times I have high school athletes or any kind of middle school athletes come in with any kind of just like general knee pain, elbow pain, back pain, and you could laser over that as well. So it's a very, very safe modality. We got another question? Yeah. Great question. So that laser has a couple different settings. So you have like large, moderate, small joint size pain. So basically shingles lays dormant in it's your dorsal root in your spine. So what that happens is when you get the photon energy, it basically kind of helps to not only help with the symptoms of the shingles, but it will kind of help clear up the skin irritation of it as well. So they actually have a setting for shingles over there. And I've treated 2 patients with it, and they got great results. Yeah, so if anybody has a flare-up, you could do that as well. Any other questions on the laser? We good? Okay, so next one we'll go to is the cupping therapy. So I use cupping therapy on, it depends on the patient. So this article, this just came out a couple years ago. This basically just talks about just a general neck pain and what cupping does for it. So when you put a cup, and there's a million different ways to do it. So what we do here is we do dry cupping. So the difference between dry and wet cupping, if you go to an acupuncturist or any kind of, physical therapist, chiropractor, sometimes they'll actually like put holes in your skin to actually kind of draw your blood to the tissue, and that's kind of wet cupping. We just do dry cupping here. So what we'll do is you put the cup on and it creates a vacuum, so it's going to help bring blood to the area so you heal quicker. And this talks about the hemodynamics, so fancy word for, just basically describing blood flow. So the cupping increases oxygen and hemoglobin levels in the tissue, and this study shows this is a good short-term relief for acute pain. In the long run, it's not going to help as much, but like short-term, just to kind of get you out of pain and get more blood flow to the area for you to heal, works great. All right, and so cupping got very popular. I can't remember what Olympic Games it was, but it's when Michael Phelps went off and he got 12 gold medals or whatever swimming. So that was the first time like a lot of people saw cupping therapy used. And a couple other things that it does: it releases scar tissue and fascial adhesions, it reduces the intensity of trigger points, improves circulation in the blood and the lymph, relieves pain, and promotes mobility and range of motion. So there's a couple different kinds of dry cupping techniques you could use. So static cupping. So static cupping is basically when a patient is just laying face down or face up and you're just putting cups on and just letting them stay there. So that's going to facilitate the improved circulation and just help promote healing that way. Another way that I like to use cupping is movements through cupping. So if we try the static cupping, let's just pick a general low back pain, and you come in the next week, doc, my back's still kind of feeling jacked up. What I'll do is we could actually put cups on your rector muscles, the main muscles in your low back, and have you go through certain movements with the cups on. So why I like doing that is, a couple different things going on here. It's going to pull the skin in the fascia. So your fascia is connective tissue. So I describe fascia as basically like a pantyhose surrounding a muscle. So what we're going to do is we're going to pull the skin and the fascia off of the tissue. So then when you kind of do movements through the cups, you could just get better blood flow to the muscle. And that also works with like peripheral nerve entrapments as well. So let's take a let's take a carpal tunnel patient. So say you're coming in, doc, my hand's numb and tingly. I have no neck pain, no any other kind of pain. It's just my hand throughout certain times of the day. Say I send them for a nerve conduction study and they only have mild or no carpal tunnel syndrome. What usually happens is there's a muscle in your forearm. It's called your extensor carpi ulnaris muscle. Sometimes you could have such a nasty trigger point right there. It's just a tight ball of muscle, and it's grabbing that nerve that goes down to your hand. So when I do the movement through the cupping, you actually put the cup on the muscle and have the patient go through certain ranges of motion with their wrist, and it will kind of basically pull the skin and the fascia off of that muscle so that nerve could be released so you don't have the numbness and tingling in your hand. Carpal tunnel, in my opinion, is definitely misdiagnosed. A lot of people coming in, oh, I got carpal tunnel, my hands are numb, tingly. Not necessarily the case, because most of the times when you send them for a nerve conduction study, it comes back negative anyway, and it's usually coming from a source higher above. So the movement through the cupping works great for any kind of like localized low back pain, and especially any kind of peripheral nerve entrapment. Another one that you could do is called a sliding cupping. So you put any kind of, we use China gel here. You put any kind of lotion on the body, and then you could actually slide the cup up and down the skin. And that's just a better way to kind of increase the circulation and release those trigger points as well. All right, and the next thing we offer here that I use a lot of is called instrument-assisted soft tissue mobilization. So basically, that is just meaning that we are going to use a tool to kind of help break out any kind of trigger points or any kind of myofascial pain. So what happens when you do any kind of grasp technique is there is controlled microtrauma and affects the soft tissue structures, and you'll actually have an inflammatory response short term, which facilitates a healing response. So how I like to do the grasping is if anybody has any kind of like tight low back, tight upper traps, I usually heat it up with the laser first, because the only byproduct from the laser that we have is heat. So we use that in our favor. So once collagen, so most skeletal muscles are all collagen based. Once that gets heated to around 100 degrees, the collagen becomes a little bit more pliable or mendable. So once we heat it up and get the grasping tool on, you're just going to allow that myofascia to organize in a more linear fashion. So when we think of a trigger point, think of the muscle, like I guess it's, Phil, can you, I'm on here. So when we think of the, like a trigger point, basically your myofascia should be kind of nice and lined, linear like this, so it slides well. But what happens when you get a trigger point is it kind of gets all junked up, and then it kind of just gets stuck here. So it's a tight trigger point. So when you're moving your neck and you kind of feel, oh, I feel kind of tight right here, it's because that's that trigger point right there. So once we heat it up and go over it with the tool, it's just going to allow the myofascia to organize more linear. So then when you go to move your head certain ways, you're like, wait a second, I got a little bit more range of motion there. So I use that not only on athletes, but just everyday people as well. So the Graston tool, soft tissue mobilization, is just a great way to kind of just release any kind of old tension in muscles and just give you a greater range of motion. So basically, it just this slide is just talking about different kind of adhesions and how you could basically break them up with the tool. It's a stainless steel tool. Depending on the practitioner, sometimes it could be extremely painful, and sometimes it could be a little bit more gentle, depending on the patient and the injury. Where I like to use this a lot is just because I do work with a couple different PTs that will send patients over, especially post-op. So the most recent one is we had a bicep tendon tear, a distal bicep tendon tear. So he basically got he tore the head of his bicep off, and then it had to get he had to go to surgery to get it reattached. He had a nasty scar down on his elbow. So what we did, so he didn't develop, it's called a keloid. So it's basically kind of thick fibrous tissue that limits your range of motion. We would heat it up and then use the Graston tool over the scar just to kind of decrease that trigger point so he gets his full range of motion. So any kind of post-op, whether it's low back, neck, knee, shoulder, the Graston tool works really, really well to decrease like that superficial scarring, so you're not getting hung up by any kind of like adhesions on your skin or superficial muscles there. And this kind of works the same with the cupping. So you are going to bring blood flow to the area so you get heal. This one is a little bit more aggressive because you're actually kind of like going into the tissue. So sometimes people say it's painful, but the result after getting the Graston is just going to allow you to heal quicker. So I like using that on a lot of patients as well. Benefits, so if you have excessive scar tissue, that will definitely help break that up. Any kind of tendonitis, tendinopathy, muscle ligament strains, joint sprains, and it works really well with running injuries as well. So like IT band syndrome, TFL, plantar fasciitis, that works great. Couple contraindications: if you have an active form of cancer, you're not going to scrape it out. You stay off of that. Bone fracture, we're definitely not going to do that. If you have also like a bad diabetic neuropathy, you don't want to damage the nerve. So, and I'll get into how we treat diabetic neuropathy, especially in the feet, a little bit later on. Or if you have any kind of severe peripheral artery disease, just because you're going to kind of damage the veins too. So. And the last one that we have, it's called a Norma compression boot. So here's a picture of LeBron James. He kind of made this popular. The best analogy for the Norma compression boots is you have these two kinds of people. So you're brushing your teeth in the morning. You're at the end of your roll of your toothpaste. Some people can just kind of squeeze it, put it on. Okay, it's done. Throw it in the trash. This works by pneumatic compression. So if you're the kind of person that says, oh, there's still some toothpaste in the bottom, and you kind of inch up along the way to try and get it all the way to the top, that's essentially what it's doing. So it works distal, so it works at your feet, and then goes more cephalad towards your head. So basically, it's like a big blood pressure cuff, and it's going to squeeze all the lactic acid out of your legs and all the metabolic waste. It gets highly oxygenated and nutrient dense when it goes through your vital organs. So then I call it when you thaw out, so to speak. So when all the blood rushes back to your legs, it just has all that good healing factors. So this became very popular for athletes, like working here. A lot of my wrestlers, football players, they'll come in and they'll do this, especially during camp week. Because their legs are absolutely shot. But you could also use this, general people will use this as well. So what it does, it will decrease the recovery time. It increases circulation, reduces any kind of local swelling, and reduces muscle tension and inflammation due to bringing oxygenated blood back down to your lower extremity. A couple contraindications, they're all acute. So if you're in the acute phase of any kind of pulmonary edema, acute congestive heart failure, this would not be for you. But if you have If you have any kind of like lymphedema that's not acute and that's been kind of long term, we put patients on that all the time. If you have any kind of neuropathy in your leg, numbness, tingling in your leg, if you are not able to exercise due to you have too bad knees and you just kind of want to enhance your blood flow, this is a great way to do it. So I try and get in these once a week if I'm not slammed busy. I know Dr. Orbach likes to get them in as well too, if we have time. But a lot of people use this pre and post marathon run, any kind of athlete. And again, if you just have poor circulation, this is a great one for you as well. So getting back to how this could work for neuropathy. If we take diabetic neuropathy, for example, so just kind of like numbness, tingling in your feet, your feet don't feel like they're connected to your body. There are a couple different things we could do. Number one, bring in your lab work. I love looking at lab work, and if you have an A1C that it's manageable, and when I mean manageable, we want to see it definitely like under 7, hopefully. But if you have an A1C that's over like 10 or 11, that's a bigger fish to fry, and we got to get you on some supplements first before we can kind of help with the neuropathy. And just my diabetic protocol that works really well. The glucolyze, just because that helps with the insulin sensitivity within the cell. The pro oranges, magnesium, and then neuropathies. That's absolutely massive, the B12 for that as well. But once we get your A1C at a manageable level, this will really, really help with the diabetic neuropathy, also as well as the laser. So when we get the laser, we were talking about the different channels on the cell, on the nerve. Basically, this will kind of help to bring blood flow to the area, so that could help decrease your neuropathy symptoms. So I see that a couple of times a day, at least 1 or 2 times a day, any kind of radiculopathy or neuropathy symptoms in feet and hands. And not only do the boots work well for the feet, but the laser does as well. And then what we could talk about too, just the most common things I've been seeing the past couple weeks. We'll talk about that. So a lot of times people coming in, tight upper back and traps. I am a big advocate of home exercises, and I think I could maybe show one here today just against the wall. I love treating people, but it is absolutely vital that you do stuff at home as well. So we'll just take a very easy example. A lot of people coming in, tight upper back, tight upper traps. Doc, what can I do outside of treatment? Okay, so if you come in for treatment, we may use the laser, we may do the cupping, the Graston. Myself and Dr. Orbach do different kinds of stretching. And then there's a couple things you could do at home as well. And I can only basically show one today, just because we're limited with where we're at here. So a good one to kind of start with, I call them desk jockeys. So if you're like a 9-to-5 worker at a desk, Monday through Friday, a lot of times people get is called like an upper cross syndrome. So your posture kind of wants to go down, head goes forward, shoulders round. So everything we need to do is to try and reverse that, right? So a lot of times I do even just start with any kind of like chin retraction. So the best way to do a chin retraction to kind of get your head back is think of someone real ugly trying to come kiss you, and you're getting away from that. So, and you could even use your finger to kind of help facilitate that. So you're just going to kind of push your chin back, and this is going to kind of help with that anterior head posture. So you could also do this if you have any kind of neck pain running down an extremity. That's called Mackenzie's end range extension protocol. That's a pretty darn good one. So the chin retractions is a start. And then the other thing too you could do is called a wall angel. So don't watch my left shoulder. I had a couple surgeries on it. It's kind of messed up. But long story short, a wall angel is okay. So for the wall angel, basically you want to have your heels against the wall, butt against the wall, and then you're going to go arms up like the field goal's good, and you're just going to kind of walk it up the wall here. And this is called a wall angel. So this is going to kind of reverse everything that you're doing sitting hunched over like this. We're trying to bring the shoulders back, neck back, just so you have better posture. So a lot of times the upper back pain and tightness is due to, the inverse of what you're doing. Everybody's kind of sitting like this, so we kind of have to reverse it. So the wall angel is a great exercise you could do at home. I like to take people in the rehab room, and me and Phil have been trying to do a couple more videos. Scapular work, so your shoulder blade, right? So you could do scap push-ups. You could do something called thread the needle. You could do a couple of Tpi stretches. And usually, like towards the end, like the last visit for a patient, usually, I treat a handful of times, and then before I cut them loose, I call it, we'll go in the other room, and we'll go over a couple of different corrective exercises you could do at home. And then the last one for the self-trap release, a lot of people, Doc, can I do anything besides the massage gun at home? Absolutely. So say the right side of your neck and your upper trap's kind of, it's a pain in the neck. So I always tell people, if you take hot showers, right after a hot shower, what you could do is you could take 2 fingers, locate where you're the most sensitive, where you have that trigger point. You're going to look up and towards it, pin it, and then you're going to go chin down to the opposite side, just like this, pop off. So you're going to go up, look towards, push really strong with 2 fingers, down and away. And I'll kind of show you from the other side here. So you're going to find it, pin it, and then look down and away. And that is basically a technique called ART, active release technique. And basically what you're trying to do is shorten the muscle, pin it, and stretch it back out just to make it a little bit more long, just to make it longer. So it kind of works the same with the Grasson tool. We were talking about if you have a trigger point and all your myofascia is kind of junked up. When you do some of these exercises at home, especially with the pin and stretching, it's just going to allow that trigger point over time to just get more linear so you don't have that trigger point. We got a question. Yeah, absolutely. So I think this was maybe 4 years ago. I got certified through the Titleist Performance Institute. So basically, I'm a huge golf guy. I'm actually golfing on my day off Thursday, if we get good weather, hopefully. And I love when people coming in, not only just, hey, Doc, when I'm golfing, when I'm swinging a club, usually after the turn, hole 11, 12, I'm starting to have discomfort in my back, my hip, my elbow. The Titleist Performance Institute, basically what we were trained to do is you take the golfer through its 15 biomechanical movements in the golf swing. So you check everything from neck all the way down to your ankle. And this takes about an hour to do. Very detailed, and we measure everything, and you look for any kind of deficiency in your biomechanical range of motion. So a lot of times, actually, when people are having like hip pain when golfing, it's coming from a lack of mobility in their low back. A lot of people, when they have pain in their knee, it's actually coming from a lack of mobility in their hip. So we take you through the 15 biomechanical movements in the golf screen, and then what we'll do is that's basically the first visit, and then the second visit, people come in, and then we basically go in the rehab room, and then we go over all the different stretches and exercises you could do pre-round and post-round. A lot of times I'm talking to people, let's just take a 45-year-old guy coming in. Yeah, I've been feeling pretty good. I started golfing more, and now my back's killing me. You do any stretching? Right? No stretching, no warm-up, nothing like that. So we kind of come up with a personalized game plan, what you could do pre-round, just so you could golf pain-free. And not too long ago, me and Dr. Orbach were treating a patient. We were sharing back and forth. If I'm not mistaken, it was elbow pain, correct? Yeah, and so we took him through the TPI screen, gave him a couple corrective exercises that he could do, gave him a little bit of treatment, and then he was golfing. I think he golfed up to 36 holes one day, asymptomatic, no pain. So that's really, really fun for me. I'm a huge goal-oriented guy. So whether it's, hey, Doc, I want to be able to pick my grandkid up off the ground, or I want to get in and out of my car a little bit more efficiently, any kind of goal you have, that is my goal, to meet your goal. So everything we do is personalized just to give you a better quality of life. Yeah, the TPI is very, very fun for me, and now's a good time to do it too, just because even though it's the end of the golf season, I work with a couple different golf pros as well. So what we'll do is, if you're going to your golf pro, I'll get in contact with them. Hey, are they coming over the top? Are they sliding? Are they kind of swaying into their swing? And they kind of just give you a couple different things that could be going on. They come in here, we do all the therapy, and then send them back for their golf lesson. So believe it or not, actually, the TPI screen becomes a little bit more, people get more use for it actually in the off season, so they could do most of the stretching and exercises, outside. So, okay. And we'll go to a couple other things, that are very, very common too. Low back pain. I would say, 4 or 5 patients a day are going to have any kind of low back pain, right? So not only are we going to treat it in here, I like doing a lot of core stability exercises. So that's the yin with the yang. So if you have weak core stability muscles, it's going to compromise your low back, because it's going to tax, it's called your erector muscles, your paraspinal muscles, to work a little bit harder. So what we do in here is, if you have any kind of low back discomfort, we'll go in the other room, and then we'll talk about different core stability exercises. So one of the top physical therapists in the country, his 4 favorite, One's called a dead bug, which Phil, I guess we should release that video this week. Me doing it, just because I can't do it right here. But the dead bug is one of the main core stability exercises that I like. And then stay tuned later this week or early next week. We'll post that video so you could do it at home. And we have different progressions. So we have the easiest, the moderate, and then the advanced level. So yeah, we'll talk. Yeah, and we could even, I guess if you pull that up, we'll show it. But, yeah, so the dead bug's massive. Any kind of planks, so front plank, side plank, a pal-off press, and a bird dog. So those are like the main core stability exercises. Let's see if we got it right here. Because a lot of people, when they think, let me get my core right, everybody just wants to go to the Russian sit-ups, like the just crazy like hanging sit-ups, windshield wipers, and everything you do like that kind of compromises your. Okay. Yeah, so this is the dead bug here. So this is a starting position. You're just going to move your legs. And the biggest thing about doing the dead bug is you want to keep your back as flat as it can on the floor, because as soon as you have an arch in your back, that's going to compromise your lumbar spine. And then so I always tell people to start just with your heel. So you're going to take your heel down, touch, and bring it back up. The slower you go, the harder it's going to be. And Phil, we could even pull up the mid-back one for the tight upper back as well. Yeah, so with the dead bug, what we're doing here is, so the start is you're just going to take your heels down and touch. Second, you're going to get your arms into it. And then third, you could either use a resistance band, or I like using the physio ball. And when you kind of compress down, that's going to engage your core. You have to engage your core to hold the ball there. And then when you move the extremities, that's one of my favorite core stability exercises right there, the dead bug. And then we did another one last week too, which is going to be pertaining to the upper back and the tightness in the back here. So again, a lot of people who are working from a desk, 40 hours a week, I'll just be honest, I preach perfect posture all day, but it's really hard to work, especially just completely in perfect posture. So there's a couple different exercises we could do. So talking about the TPI, this is one of my favorite golf exercises you could do. So that is actually my favorite mid-back. That's my favorite exercise for the mid-back. But let's see what the first one is. Okay, so this is an open book. So this is very easy for anybody to do. I like to use the foam roller to kind of pick my leg up. I think it works a little bit better. And you want to breathe through the motion when you're doing this. So when you were doing the open book, you want to take a deep breath in and exhale as you open the book, so to speak. And then, again, that's probably one of my favorite, that TPI against the wall. And the one with the TPI stretch against the wall, the bigger the object you're pinning against the wall, the easier it is. So start with something a little bit bigger. So you could go like a paper towel roll. And once you get efficient with doing it with a paper towel roll or a foam roller, you could get something a little bit smaller, like those disposable Lysol wipes. That's a little bit smaller than a paper towel roll, or anything, even just like a small soccer ball, just to pin against. And then that's one of my favorite upper back stretches as well. So that's what I love about my job, love what I do. Not only getting people to feel better, but to give them things that they could do every single day just to improve their quality of life. So stay tuned. Me and Phil are starting to put some time on my schedule so we can start to do some more videos. That's fun for myself. Phil, you have fun doing that? Yeah, and you can find it on our Instagram. Our Instagram is World of Wellness Pittsburgh. Or Phil's gonna pull it up, but
World of Wellness PGH.
World of Wellness PGH. So you could follow us on there, and then over the next couple of weeks, we're gonna start to do more and more videos. Just because, again, it's really fun treating people in here and getting results, but there's only so much we could do in a half an hour, right? So it's really, really nice that we have, you could get them on Facebook or the Instagram, where you could just say, you know what, he was talking that he does a couple exercises for his mid-back. Let me look into him. Or my knee's hurting me. Let me see what he has for the knee on the Facebook or the Instagram. So feel free to start looking over the next couple weeks. Me and Phil are going to get pretty active with it. And I guess that's my spiel Tuesday morning. We have any questions? All good? All right, guys. Well, we got one question. Yeah, great question. So
Can you repeat that question? That was a great question. Can you repeat it for the crowd?
We have a question that said the TPI. So we were talking about the different stretches, exercises, and all that stuff. Can you take that and use those principles for just everyday people, whether they're, sitting driving a truck for their job, sitting at a desk all the time, or retired and just trying to improve the range of motion? Absolutely. So the TPI is almost kind of a spinoff of something called FMS and SFMA. So it's basically a functional movement analysis that we take people through to see where they're deficient in motion, and then we give them corrective exercises to kind of increase their range of motion, so to speak. So, in my prior clinic, we did a ton of SFMA protocols, especially with the athletes. You could do that with everybody as well. So, yes, you could definitely take some of those principles, stretches, exercises, and incorporate that into just everyday people as well. So, all right, guys. Well, thanks for tuning in. If you have any questions, feel free to call and leave your name and number. I could talk to you over my lunch. My email is drross@wowpgh.com if you want to reach out to me with any other questions. I love looking at lab work too. So just recently with doing the videos with Phil, I'm having a lot of people bringing in their lab work just because we are so blessed with a supplement company here. And I like the lab work because it's a nice objective measure of everything in your body. So, for example, just had a lady coming in, this was last week, fatigue. We ordered lab work and came back, her vitamin D was actually deficient. It was in the 20s. Well, there's your fatigue right there. And so it is just really, really nice to get an objective measure. And then it's so simple to just walk out and say, hey, you're deficient in B, magnesium, D. You get the supplements, and then we recheck your blood work in either 4 to 6 months. And it's so cool when you see that come back that you're completely normal in the baseline there too. So love looking at lab work, interpreting lab work. Especially if it's things that you don't think you could see a chiropractor for. So I am not saying I'm treating any of these conditions. We're helping with the symptoms of them. So a couple patients I have right now that we're looking pretty heavy into the lab work. Osteoporosis, osteopenia. So if you get a DEXA scan, you have osteopenia. What we can do supplementation-wise so you don't progress to osteoporosis, and cannot make this up. We just had, her husband came in, a woman I treat, she had osteoporosis, and with the supplements she took from here, she actually went back down on her last DEXA scan earlier this year to osteopenia. So it actually kind of reversed the change. That's awesome. So things that you don't think we could treat. So osteoporosis is one of them. Also got a patient right now helping his symptoms with Parkinson's. Just got diagnosed with Parkinson's in March. So we are helping with supplementation recommendations. He's doing everything with his primary doctors, primary care physician, but we are basically helping along the way with different supplementations so he could have a better quality of life. And a newer one I just had this past week was an MS. Patient came in with MS, had it since 2015. Doc, is there anything I could take to kind of help relieve my symptoms and help delay the progression of MS? Absolutely. So we ordered her extensive lab work, and now we just, I recommended a couple supplements for her, but she's going to talk to her nephrologist and her other doctor, and we're going to kind of co-work with it too. So a lot of cool things, especially with the supplement company out here. So yeah, if you have any questions, feel free to email, call. If you're a new patient, please bring in your lab work. Bring in your lab work, and we'll take a look at it, get you on some good supplements, and get you rocking and rolling, get you feeling a little bit better. So thanks, guys. Appreciate your time, and we'll see you next